there's something very different happening there. You might get the same information, but when a person asks me how I feel something. I feel something different. It does something different. I'm not saying it shouldn't happen, but I think what you've said there is a critical point about the role of humans in care and technology in care.
Welcome to the Healthusiasm Podcast, a panel discussion on innovations in health and self-care. My name is Christophe Jauquet. I'm a health business expert, author, and professional keynote speaker. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have a full panel. 3 of your beloved experts are in the panel today. From Scotland, but living near Brighton, medical expert and digital innovation, Dr. Keith Grimes.
Good morning, everybody, or good afternoon, wherever you are.
From Colombia, but living in Berlin, digital health expert for startups, Nia Escobar-Kölle.
Hola, hola, everyone.
Hey. And last but not least, from Ghent, Belgium, human experience expert, Mo Zouina.
Hi there.
Hey, that was not very enthusiastic, my man. Come on, try again.
That was my Barry White impression.
Yeah, he's
wasn't a good
he's
one.
Bringing the
He's
bringing the walrus of love.
Yeah.
Yeah, we'll get there. It's going to be a fun one this week. We will talk about the Healthusiasms of the month of November. Some positive changes, some innovations that we have seen in the past weeks and that we would like to share with our listeners. So without further ado, tell me, Nia, what Healthusiasm did you witness in the past month?
Yeah, of course. Very happy to share. So recently, Lilly, the pharmaceutical company, actually announced that they're expanding the digital health footprint with a $42 million investment in Singapore. I was not surprised to hear this because we know that Singapore is one of the most forward-thinking countries when it comes to healthcare. They have done incredible investments when it came to COVID-19, for example. They have a lot of prevention programs together with Apple Watch. But then the more I read about this, the more it made me question and also follow the conversation from our last episode on hospital tech, is that this new digital health innovation hub, as they're actually calling it, is also co-developed with the government, but is focused on AI-powered healthcare. So the idea of this hub is that it will advance research in therapeutic areas like cardiometabolic health, neurodegeneration, and oncology, and sleep disorders as well. And that Eli Lilly is actually using their own AI model. It's called Magno AI, that is also a state-of-the-art sensor cloud platform. So in the previous episode, we're talking about, the hospital of the future, that it could have, it could cover a lot of sensors, connectivity, prediction as well. And the more I read, I realized that with implementing this model on this platform, actually, Eli Lilly is already developing this hospital of the future. So they have done some pilots with the Magno AI last year, and they actually realized that they could streamline the integration analysis of sensor data. And this means that this innovation center will actually be able to collect data from patients on sleep disorders, any activity that they're moving, their body temperature, actually going to the bathroom. So the loos themselves will have sensors that will measure how much the patients are actually going to the bathroom and the activities that they're doing in the bathroom. And I was just very, very happy to see how the hospital of the future is actually being built right now in Singapore, but also made me question, how can we actually expand this beyond the pharmaceutical industry to really have mass delivery to patients all over the world?
Interesting one. I mean, it's interesting that a pharmaceutical company is bringing this forward, right? And it's interesting that a hospital accepts this kind of initiatives to be tried out in hospitals, maybe, because those relationships are not always the best ones, I believe. I'll stick into the hospitals and I'll stick with AI. Have you heard of the Healthcare AI Challenge Collaborative?
Nope.
It's something which happened in the States just really recently. So we know that, ever since the launch of ChatGPT in 2022, there's a lot of companies, big companies, Google, Amazon, Microsoft, OpenAI. They've all been trying to get these AI tools into healthcare as well. But it's very hard for healthcare providers to know which one to use, how to compare them. So it's kind of a bit of a struggle to know where to use which one and whether they are up to standard. And so now there's a group led by the Mass General Brigham which is the largest hospital-based research enterprise in the United States. And they are trying to solve this. And what they've did is they put forward this initiative called Healthcare AI Challenge Collaborative. It's a mouthful. But the purpose is that clinicians will test and compare tools, mainly in areas like, report writing, diagnosis, any findings that they could get from all the analysis that the AI is doing. And it will be evaluated on the level of accuracy, readability, usability. And so by the end of the year, their purpose is to have some sort of leaderboard, if you will, that ranks the different tools on different elements and in different areas, which is interesting. Certainly for smaller hospitals who do not have the power to actually, compare these tools. At the same time, I think if you start now or they started a couple of months ago already, but if they do it right now to have a ranking, I'm not quite sure how fixed such a ranking is, because these AI models, they change all the time, right? So it's very, very hard, I think, to do this. It's a noble initiative, but how can you make sure that the ranking is still up to date? Isn't it, Keith?
Yeah. This is really interesting. As the wider healthcare community gets to their brains and their hands on these models and starts thinking more deeply about whether we should be using them or not, evaluation is a very key area. So there's a lot positive about this. The idea that we're trying to find a common framework or standard beyond AI passes exam. This is very, very welcome. But at the same time, I think you also pick up on an important fact, which is it's also not that helpful, because for every AI that is tested, it is tested at a time and it is tested in a place. And AI changes. And it changes in time with new models and capabilities. But crucially, it also changes in place. If I test an AI for my patients and practice in one area here in the UK, I cannot expect that it will do exactly the same for you, Christophe, Mo, or Nia in your own place as well. So I think the really important thing here is more the establishing of a framework, a common way in which we say we're going to measure things, sharing that and making that easy. But I'm not a believer in one person or one group doing that. And I think that's the downside on this. Chai have proposed the same thing as well in the US with model cards and safety cards. So I think we need to watch it. But underlying it all, understanding what is success, what is positive, what is negative, and sharing that is great news.
Yeah, I fully agree. And it's not easy indeed to have this clear overview of what will be the best one or a ranking. I really dislike the idea of ranking. However, there could be some very interesting things coming out of it for sure. Up to you, Mo. You had one on potential, but not potential of AI, but something else.
Well,
Please
maybe
elaborate.
a little bit, Christophe. It's about the power of potential and the power of placebo, which is, of course, is not new, but it is applied to the world of human augmentation technologies. Now, let me just frame that. What are human augmentation technologies? Well, imagine a firefighter navigating through smoke with augmented reality, or workers, handling heavy loads thanks to exoskeletons. It's just technology trying to augment the performance or the safety of specific tasks. They're just enhancing our abilities. They're redefining the limits of what we think we could do. Now, there's an interesting research and also a surprising twist from recent research is that when people use these augmentation technologies, of course, they're more performant, but when they stop using it and when the augmentation devices are turned off, people report feeling more capable and often take greater risks due to the placebo effect. So something that was developed to help you be safer kind of develops a behavior that makes you take greater risks. And it's about the double-edged sword of this placebo effect. And it has a double-edged sword. For instance, the power of potential. We've seen in Ellen Langer's research on the counterclockwise experiment that putting people in a setting where they think they are performing just boosts performance, despite the fact that physically nothing has changed. They run faster, they see better. Just a counterclockwise experiment, Nia, is an old project where elderly people were put in a bus that looked like when they were young, in a room that looked like when they were young, and suddenly they could lift more things, they could see better, they could hear better, they had more muscle strength. The backside of it is the darker side of the placebo effect, where believing we are technology enhanced can lead us to make riskier decisions without any real information supporting that risk behavior or guiding you towards that risk behavior. And that's a big point about all these health tracking gadgets. They might make us feel invincible or nudging us to push past our limits without thinking about the real risk and ignore our physical limits. So basically, the fact that we know what we are doing might push us go beyond our physical limit or the safety of health. So it's interesting. And those listening to this podcast and those people who know me might recall me often saying knowledge does not affect behavior, right? Well, maybe today is the day I need to tweak that a little bit. Knowledge does not always affect behavior positively. So it's a nuance, but a crucial one. The fact that you know things, okay, gives you a certain attitude towards behavior and the things you do. So it's interesting to further examine how augmentation and technology influence our actions in a positive or in a negative way.
Interesting. I think there's a lot to think about there. I'm still letting it sink in. Meanwhile, I want to stick with that technology that enhances people. I saw you on the screen here and you were wearing the Aura Ring. Is that one of the technologies that can enhance yourself?
I think so. I think so, yeah.
Yeah, because we talked about 3 weeks ago, we talked about how Aura Ring bought Veri, which offers personalized metabolic health programs, which is a major step because it's clearly that they're moving beyond the sleep tracking. But just a couple of days ago, Aura announced a partnership with Dexcom, which is a huge name of obviously in health tech and definitely in metabolic health as well. How did the partnership, or what is the type of partnership that they established? It's a $75 million investment, which is pretty interesting because Veri was already focused on metabolic health programs. Dexcom is a leader in glucose monitoring. So together they'll be working on systems where you could actually track your blood sugar alongside the other health metrics that Aura is already doing. So it's really a very important step for Aura, again, who really is going all in right now because, and this is the feedback from Aura themselves, they say that 97% of their users, they really want to understand how their food impacts their health. So it's good to have these health metrics, but now if you add Dexcom and Veri and everything that they provide, it's even more powerful. Veri would be no longer existing as a brand. It will be fully integrated by the end of the year in the Aura app. And then the integration with Dexcom would be expected already early 2025. So they're going at an enormous speed there. And so really the purpose is to have these personalized connected health tools way beyond just sleep tracking. By the way, just to show how big and far Aura has as from an ambition point of view, is they've already integrated, or they acquired actually, a startup which is called Proxy, which is a way to open, it basically replaces keys. So it's a way to open your house. It replaces your payments, your cards, your payment cards, badges, certain apps, etc., passwords. So that is already another aspect that they're adding to the Ring. And they also added new software features, which helps you to know your cardiovascular age, your cardio capacity. So, I mean, all but news in 2024 that showcases how very ambitious Aura is at this moment. So, would that enhance the potential of human beings positively or negatively, Mo?
It's a double-edged sword. I think, we talked about orthosomnia. I think in the last one, how stressy will you get from things that are not in line and things like that? How much information are you sharing? What is the UI going to be about? But what I love about it is, as I said earlier, I think it's good to use technology as a closed loop to sensing yourself. Is my feeling aligned with what the data tells me? And then gradually being less and less dependent on technology and being, your own data system. I think that's the ambition, not for Aura, but for me.
Yeah.
I think a concept that I like a lot, and I have an Aura Ring. I also have tried multiple devices, including continuous glucose monitoring, despite I don't need it. I don't have any health condition, but I wanted to understand the experience working in health innovation, of course. So I had Veri, I had a sensor myself. And what I realized is that at some point, I was completely overwhelmed with information overload. And this is also known as infobesity or infoxication. And is basically when we consume so much information that it's so difficult to understand it and to effectively make decisions which is when you have too much data and you don't know what to do with it. I'm really happy as an Aura user. I think I've had it for the past 4 years, and I have absolutely seen the development as a user of the algorithm in Aura and the information and the insights they bring. And in one side, I'm extremely excited to see how it improves and how other solutions will be integrated to the Aura Ring. On the other side, I'm also worried to see how much anxiety will this bring to people who just maybe do not have the knowledge or the education.
Yeah. Yeah. So I'm going to sort of take a different route. The first thing is now I want to buy an Oura ring. Okay.
Yeah, me too. I have the same feeling.
Yeah. I'm like, oh, I want
I
an
can
Oura
give
ring.
you a discount.
Yeah. Well, here's this. So let me just take it back a bit. Okay. And so this is, there's a lot of positives with this. And then as Mo says, and Nia says, there's this, the downside, the anxiety. Another term was, orthorexia, about being, it all comes back to what is normal. Now, when measuring things helps you understand what's normal for you, that can be good. But when you start saying, well, what should normal be for me, as in you're comparing to other people, then you get the anxiety. But I just want to draw everyone's minds to another places. Let's look back to nature. Let's look back to our own bodies. We already have way more sensors in our own body, right? We do this, and we are not aware of what those sensors are doing, our nerves, our hormonal system, and everything like that. I think that's actually quite instructive, all right? Imagine if every single sense that we felt was constantly in our mind, constantly in front of our mind. We would be overwhelmed. It would not be useful. We couldn't attend to things. So our organic operating system filters and handles all of this. I just think it's important to realize that internal homeostasis, that handling, appears to be an evolved organism's best way of handling important information. And right now we're at a point where we're getting all this information and it's being presented up front. My sense is it should be moved to the back. I don't want to know about these things unless I need to know about these things. If I get too much, I get anxious. That's maybe one perspective on this. But at the same time, we do learn some other things. So I don't know if how everyone thinks about that.
Yeah, but I think they're tapping into the need of agency and control. And once again, how does that translate in behavior? Because that's the final thing. Are you going? I love the closed loop thing, but I think it would be interesting that people also, as you say, people need a focus, and that you say today this is the single thing you need to know, or I think that is workable also from a stress load point of view. So what I'm missing is, first of all, we see the fragmentation of all these apps, and they think that giving more information is a differentiator. And what I hear from you, Keith, is not giving more information, but giving the right information that translates best into behavioral change. No one has addressed that. And that's why I'm here on the podcast together with you. I think, Nia, all the startups don't have anyone talking about human behavior or cognitive load or anything else. So I think, and we discussed that on health too, all these startups just focus on functionality and not on the endpoint. What kind of behavior and what do we need? How do we need to engineer that to trigger behavior? So that's a real interesting part.
And I really like what you were mentioning, Keith, and also your point, Mo, is that everybody is a different universe in a way. What some people might need 8 hours of sleep, some people might function perfectly fine with 5, because they are research that shows that some people have genetic traits that allow them to function completely fine and thrive with 5 hours of sleep, for example. And in a way, it's disconnecting us from feeling our own bodies and trusting our own intuition and understanding, okay, I need 8 hours of sleep, but how do I actually get to those 8 hours of quality sleep and not just what the general recommendation is. And I think this is a really interesting bridge that hopefully will be solved in the future, instead of just giving this analysis of data and comparing it to general population and general health advice.
And to piggyback on what Keith was saying as well, I think one of the terms that we see more and more is natural intelligence instead of artificial intelligence. One of the other words are rewilding. I'm actually writing a newsletter now on this topic, so I think it's very much on point. And Nia, by the way, I really liked your infoxication type of word. I never heard that one before. It was a really, really cool one.
Just a last remark, maybe. None of these apps asks us how we feel.
No, that's not true.
Well,
that's not true. I have 4 or 5 apps. I'm sick of apps asking me how I feel, honestly.
Well, basically, just to benchmark, Ura doesn't ask me how I feel, and what's the delta between how you feel and what we see, right?
Yeah, I'd say I have my Calm app. 2 of my sleeps apps are doing it. I have
Yeah.
my health app from Apple who does it. So there's a lot of apps who does it. Basically, way too much.
Okay.
Yeah, and I'm just going to make one point here: is that does it feel the same if an app asks you how you feel, or if a person asks you how you feel?
Yeah, sure.
There's something very different happening there. You might get the same information, but when a person asks me how I feel something. I feel something different. It does something different. I'm not saying it shouldn't happen, but I think what you've said there is a critical point about the role of humans in care and technology in care.
So one thing that is still missing in the Aura Ring, Keith, is voice then.
Oh yes, I don't even have an Aura Ring just here. Oh yes, no. Well, you're right. You're coming onto my health enthusiasm, and I've been thinking about the voice, and I'm thinking about the voice because I was at a voice workshop. I do a lot of presenting, and I had a voice workshop this last weekend, and it was great. I've been thinking about it a lot, and my wife has also been helping a performance artist do a 12-hour singing marathon in Luxembourg. So voice is really in my mind, but the thing that I wanted to bring to everyone else here was about singing and memory. So I think everyone's aware of the positive power of singing. You know, singing is medicine in many regards. But this is a specific story about a choir in West Ryde, which is here in the UK, called the Good Life Chorus. And this choir or chorus brings together people with cognitive impairment, dementia, and memory issues. And it helps illustrate the importance of singing and music, because singing and music is memory, but in a different part of the mind. A lot of other memories are. Now, Mo, earlier on, you were talking about that counterclockwise effect, that performance changing when a person is taken back to a previous time. And music and singing is really deeply held inside the body, particularly from a sort of past experience in evocative music. So there's studies that show that playing music from a certain time for people with cognitive impairment from their youth boosts performance. Add that to the social benefits of singing, the benefits to wellness, the release of endorphins, that sense of mastery. This study or this article reminded me of how we can use voice, singing, community, and music to help with literally improving memory and performance, not just at the time, that persists afterwards. Study after study shows this too. And so it's been very, very interesting to me, both personally, but also seeing this and then seeing that doctors that I know are working in this space. There's a friend of mine, Karen Barker. She's a GP up in Aberdeen, and she loves musical theatre. She has all her life. But now she sings in care homes. She takes her music to care homes when she's visiting and sings to the patients to their benefit. My wife, when she was younger, sang in the council music in hospitals that does the same, brings live music to care homes, nursing homes, and hospitals. So I wanted to see your thoughts and share this about, should we be using speaking, singing, storytelling as a way to improve health and wellness?
Yeah. Did you know, Keith, that in Thailand, karaoke is very popular, right?
Mm-hmm.
Well, the government put out a whole karaoke campaign, and I think they supported even with places where you can go karaokeing or singing karaoke for elderly, specifically for in the with the idea that you just mentioned, for people to, because it's a very elderly population, Thailand, and so they really wanted to help people remain, mentally sane, avoid dementia, Alzheimer's, and so forth. And that's why they really already for 10 years, I think they've started this campaign to have older people continue singing the childhood songs or from when they were younger.
Yeah, and Mo, I know you want to come in, but I just want to say, let's combine that, Christophe, with what Nia said earlier on. Let's put karaoke bars in hospitals.
That'd be cool.
Yeah, together with happy hour.
You told us that was one of the previous.
We already had one with happy
Yeah.
hour. I think singing combines two very powerful things. It's breathing, right? And music. Breathing in itself is incredibly powerful. But music, and then this is an invitation. In 2014, there was a movie made. It's called Alive Inside, on the quickening art of music. I've put this in the chat. Alive Inside was incredible. It used headphones for people that didn't interact with that were completely, not interacting with their environment. And you saw that for 1 hour, they had reason again, they could interact.
Mm.
And they call it the quickening art, because it does
Mm.
something on a neurological level that allows you to interact even just for a short time with these people. And it was incredible. So yes, I think this is very, very powerful. And I'm just going to share a bedtime story with you. I sing in bed or before I go to bed, because it's music and breathing. I think if you want to wind down, I don't think you have to put Michael Jackson on or anything, but something slow. Depends on what you want to do in bed, maybe. But
So what's the song? What's the song you're singing?
I sing, there's a very nice album. It's called North from Elvis Costello, which is really, really slow. It's not a new one, but these things kind of, and they have very long phrasing, very long syllables, and it
Mm.
helps me breathe. It's very, very long. It has no audience, fortunately, but this kind of helps me. And I've been doing this for 2 weeks, and it's the effects on my Oura ring are spectacular.
Yeah. I am
I think I
just as
might feel
interesting.
that.
Voice. Yeah.
Yeah.
Interesting you talk about lullabies. English National Opera during COVID ran something called Breathe, which is people who had COVID or post-COVID to help with opera singers, helping people recover their breath, but also help with their voice, because you can get voice changes after COVID due to the neurological damage, anxiety, and everything. But what did they teach them to sing? Lullabies. Lullabies, those songs from times of comfort, times when people were caring for us, the nature of the song, the pace, all of it. So yeah, powerful medicine.
Yeah, lovely. Before Mo starts singing, maybe let's move on to the next health enthusiasm. But I'll stick with the wellness type of health enthusiasms. And particularly, I want to talk about the wellness economy, because the Global Wellness Institute has brought out a new report just very recently. It's pretty interesting. If you've seen any of my keynotes, I always refer to the wellness economy and how big it is, mainly because many people in healthcare often say that people do not want to pay for their health. And basically, I couldn't agree more. Obviously, it's true that people really don't know how much healthcare costs. That is true. And in a way, they're sometimes shocked, and you could deduct from that maybe they don't want to pay for it. But if you look at the size of the wellness economy, then you really realize how much they are willing to pay for it. Because the wellness economy today, in 2023 actually, is a 6.3 trillion economy. And it is expected to reach about 9 trillion by 2028. Just 4 years ago, just before COVID, it was a 4.2 trillion economy. So it grew about 2 trillions in 4 years, which is a massive growth, which is, where spendings are done in mental wellness, personalized health, wellness travel we talked about as well, wellness real estate, your home, spas, and so forth. But why is this so important, and why do I always come back on it? It's because it really shows that people across the world have this health enthusiasm. Of course, they really want to invest in feeling good, staying active, living longer, healthier lives. And so, in a way, if it's a 6 trillion economy, you can also say that it's no longer just a luxury. At least, obviously, some parts of the wellness economy are luxurious, but not everything, right? And so it's really increasingly becoming a universal thing. And it also shows how much people really want to pay for their health and well-being. Because if you look at the wellness economy, which is $6.3 trillion, well, it is 4 times as big as the pharmaceutical industry. It is 2.5 times as big as the entire sports industry, and it is bigger than the entire IT industry as well. So that is how big the wellness economy is. It really shows how much we are willing to spend on our health and happiness.
Can I just plug a good friend of mine?
Sure.
There's a friend of mine who's written a book about health aspirations. And the wellness economy is not about wellness. It's about the aspiration of wellness, because we don't see it in the metrics.
True.
Do we see people really getting better? Do we see quality of life? So I think there's an incredible urge there that can be serviced. But the question I'm asking you, do we see it in the metrics? And I think it's a testament for how strong that urge is, as you explained, Christophe.
What do you mean? Do we see it in the metrics? Do you mean like you go back to the Oura ring and the
Well,
metrics that we measure?
do we see if if it's not a luxury anymore and it scales and more people do
Mm-hmm.
it? Do we see it appearing in the health metrics? Do people, or is it
Oh,
just, or thanks to this, it's not even getting worse because it could get worse. Maybe that's a blind spot. What would be the current situation if that industry wouldn't exist? So maybe that's the
yeah.
good.
So I think
Yeah,
we talked about it a couple of weeks ago about the Lululemon report,
yeah,
where indeed they've been seeing a growth in the overall well-being of people in the recent years, but not in the last year. Even so that if people put too much effort in trying to be healthy and happy, it might have the opposite effect, of course. But in general, we see that people are more focused on their health, that they are feeling better as well. Keith?
Yeah, I know. Actually, with what you're saying about outcomes, Nia, when you were talking about that kind of quantified hospital side of things and measuring everything, I was also thinking, well, that's great, but so what? In the sense, like, what is the outcome? This is all great. We get this data, but is it making a difference in terms of the outcome for the patients and the hospital? Measurable things that matter to them. I'm sure it possibly is, but I think it's always very important that if you're going to measure something, you have to think about, so what? Like, why am I measuring it? What is it going to do? And then when it comes back to what you were just saying there, Christophe, about this sort of market and measurables that Mo said, again, you can measure the experience and everything, and it is important to understand how it impacts on health and longevity and everything. But equally, at the same time, who cares if people feel better? Like, life isn't just a production line or a problem to solve. We have to live it too. And if the pursuit of wellness is something that makes people happy, is that enough and should be supported?
I don't get it, Keith.
Yeah, no. So I mean, when this is, well,
What do you want more? What do you want more? If people
yeah,
are feeling good, then
yeah, no. That's the point I'm making. Is
okay.
feeling good enough? Like, we don't need to do something that the side effect is feeling good, but we're doing it because we're going to be healthier. Feeling good is enough. That is the end.
Exactly.
We don't have to pursue it like in a complete sort of hedonistic fashion and just pursue pleasure all that way, but it is an important part of it. So it always has to throw in the balance. I think the middle ground is exactly what you were saying, is quality of life. And then making sure that when we measure that we realize that probably is the most important metric.
Mm-hmm. Nia?
I think it's interesting that we mentioned this because we forget that when we feel good, this also is directly correlated to health outcomes. If you're sick, you're feeling miserable, you're constantly worried, and this also has other implications directly or indirectly into your health. But if you're feeling good, actually you can do more things. You can focus on work. You can focus on being present with family. You can go for walks. So I think despite feeling good sounds like a very simple concept, it has massive implications. And it's sometimes very often just overlooked and underrated.
Yeah.
Yeah, let me just give you a last thing. If the industry is growing, that means that we have to do more things to feel good, and that the simple things we are not enough. So we need to pay for things that have been created outside of the things we can do without using a service to feel good. So the fact that this wellness industry is growing means that the basics are not maybe enough.
No, I think that's partially true. I think it's also maybe perhaps because we have more tools available and we're smarter and we have more technology and we have more people that are interested in it. It's partially true what you're saying, but I wouldn't look at it in such a negative way, I think. Keith?
Do you think the market's growing because globally, actually, we're dealing with the foundations better? As in, I can't pursue feeling good if I have no roof over my head, no water, no food.
Exactly.
If we are as a planet, and I know it's very, very unequitably distributed, but if we are broadly rising out of extreme poverty and getting those things out of the way, the
Exactly.
natural consequence might be we can now pursue that. So maybe that's it too.
It's exactly what is the essence of any keynote, and even my 2 books, and saying like our basic and emotional needs. No, it's very good. I mean, it shows that you haven't read it fully yet, but
I thought I'd done well. I need to get to the end.
But no, the basic idea is that indeed, if you look at the Maslow pyramid, the hierarchy of needs, is that our basic and emotional needs are largely fulfilled in Western society, in many parts of the world, let's put it that way. And then people become more aspirational. They have different needs, and needs are more related to the fact that they want to become the best version of themselves. That is kind of like the basic idea, and which drives a big part of this wellness economy. It's a desire to, it's a need. We simply have needs, and if the other needs are largely fulfilled, then we move on. That's kind of like the basic idea. Now, wellness, long term. We're talking about the long term impact of health in this recent discussion as well just now. But Mo, you had a final health enthusiasm on the long term impact on health of something else, right?
Yeah, about something that's maybe not as lighthearted, but it's about a recent insight into the intricate effects of natural disasters on our long-term health. Recent research from Stanford had just revealed a staggering truth. Hurricanes, for instance, don't just cause immediate destruction. They lead to a surge of death for nearly 15 years after they strike. 15 years. It means that an average tropical cyclone indirectly causes about to 11,000 excess deaths. Now, what I find interesting about that is our clarity is we're gaining clarity on how that works exactly. So we would be able to kind of quantify it, but also find solutions for that. So normally there are 3 in 100 deaths nationwide in the US related to tropical cyclones, but the burden is higher for certain groups. For instance, in Black individuals, it's 3 times more likely to die after a hurricane. But the many ways storms affect death rates over time aren't straightforward yet, and we're starting to get more insights on that. The research suggests that public spending, first of all, shifts just to build up the community again, and that means that there are less funds available to really invest into health. So we get a shift of funds. But sometimes you also see that since insurance companies don't cover everything, people use retirement savings to repair property damage, which reduces their ability to pay for future healthcare. It kind of handicaps their future care budget. Third system that I find interesting is that, some family members just move away, which means that the caring network and the supporting network also disappears. And then you have a vicious circle. If less people live there, there's less healthcare. And the quality of healthcare is that. So you might wonder, why don't these people then just also move, but then they have to move to more expensive areas. So you see that kind of vicious circle. So what's interesting is that these events can be so separated from the initial hazard that even affected individuals don't see the pattern. They don't see the connections on what it has in terms of effect on their health. So how do natural disasters affect health long after passing? It's enlightening, but it's also a bit unsettling. It's a wake-up call, and I'm looking at the business opportunity, but also kind of companies reinventing the way they offer value. If we look at insurance companies, there might be insurance policies that do not cover just material damages, but also give you include a budget to make sure that you can keep taking care of your health. So maybe we're here, and it's an invitation to redefine what damage looks like, right? So there's a big chance for these companies to step up and design new products that don't just fix up physical damage, but also really look after people's long-term health, helping them just not rebuild their houses, but also rebuild their lives and keeping their health protected down the line. So it is a health enthusiasm world. And I think the fact that we are confronted with this is also an invitation for innovation.
Yeah, I mean, that is kind of sobering. And actually, I suppose we all know it, but it's really, really interesting to hear some of the depth in that as well, the different angles that affects it. I mean, let's face it, we are going to get more storms. We are going to get more natural disasters as nature pushes back on the changes that man has wrought on the world. And we also maybe can learn from what you've said here, equally applies to war and disruption and so on. So put it this way, the opportunities here are going to grow, sadly. And also, when you're talking about this, the idea that you can move away to somewhere that's less affected, I mean, that's like going to be less helpful too. So I suppose it does really focus the mind on this. And, we just came from a thing about the growth of the wellness industry, but this is this counterforce, isn't it? It's pushing us back down the pyramid as well. So yeah. Interesting point of sort of tension there, isn't it?
Yeah. And as you said, I mean, climate change will have a huge impact on our health. And this is one of the examples that you showcase here. One of my keynotes is called No Healthy People on a Sick Planet. And I think that is the best example that you can show. The good thing is, and there's more and more noise around this, saying that actually climate change is the biggest threat to human health. And that the healthyism, to turn it into a healthyism now, Mo, is that there's a realization of both the healthcare industry as well as global leaders that the real impact or the real reason why we should be focusing on climate change is actually our own proper health. And that's where you see initiatives. So thank you for all these healthyisms. I have, per usual, a couple of unusual ones real quick to end up this podcast. And I'll start with you, Mo. I want to talk about a bold campaign, actually a promise that was done by the current mayor of Rio de Janeiro. He wants to be re-elected. His name is Eduardo Paz, I think. And my question to you is, what did he promise? If you really don't know, I have 2 tips for you that maybe might guide you along the way.
Let me just guess. He promised everyone would lose weight.
Did you read it or
No?
Okay, no. Okay, fine. Continue. Could you?
I think he made a health promise.
He made a health promise. Yes, and indeed, he said that there will be no more fat people in my city. That's exactly the promise that he made. And how does he do it? But he himself, he lost about 66 pounds by using the one thing that is almost in the Hall of Fame of the Healthyism podcast, and that is Ozempic, obviously.
Ozempic,
yeah, all these kinds of. And so he said that when the patent expires, which will likely be in 2026 in Brazil, he said that everybody will have access to Ozempic. That is kind of like the promise that he made to be re-elected. Unusual one, let's put it that way. Keith, to you. You're a doctor. You know your way around the omics, right? I presume. Could you give a brief description of what is an omic to the audience?
So omics is essentially the sort of study of the impact of health about one particular subdivision of anatomy or physiology or anything like that. So the one that you'll probably hear about is genomics. And genomics is about the impact of our understanding of the genome and our genetics on the human body. And then you can go from there to proteomics, metabolomics, and so on. So if you hear omics on the end of it, it's about, how that impacts on wellness, basically.
Okay. So my question to you is, what are exposomics?
Exposomics. So my first thought would be the exposome might be that part of, it could be from genetics, and it could be that part of the genetic code that is exposed, or maybe it's part of the protein structure that's exposed on the side of the cell. So it could be that, or try something else. Exposomics could be the study of how what you show to the world, as in my social media presence and the clothes I wear, how that affects on health. So what I expose. Those are my guesses.
Yeah, good guesses. Anybody has another guess? No?
Not really.
Okay. It's a study of how everything in the environment affects our health.
Exposure.
Exposure, exactly. Because it's not really clear how the environmental factors have an impact on our health. And so the idea of exposomics is to change that. It's something which already exists, as a concept since 2005. But it really looks at all the exposures that we encounter throughout our lives, talking about pollution, diet, chemicals, anything. And the purpose is to examine really how this shape our health. By combining this, obviously, as you said, with genetic information, to have a fuller picture on how other things that are more external have an impact on our health. Exposomics.
Actually, I could hit myself because I worked for Vichy, and Vichy, one of the claims is the exposome. So I did not
The
finish.
exposome. I was about to talk about the
Yeah,
exposome, your
in
personal
skincare,
environmental.
yeah. So basically, it's what nature gave you, which is the genome, and then you have, and I added one, which is the behavome.
Makes
So
sense.
yeah, exposome and behavome. Yeah. Okay.
Okay, last one for you, Nia.
Mm-hmm.
Do you know the expression touch grass?
Rings a bell, but okay.
I'll use it in a phrase.
Mm-hmm.
There's two phrases I can showcase, and with the second one, you definitely know what it is. But I'll start with a little more cryptic one, maybe. If you think that's true, you really need to touch grass.
So when someone is delusional.
Almost. I'll bring you the second sentence, and it's the one that I've used with my son. You've been gaming for 12 hours straight. Go touch some grass.
Okay, so someone definitely should go and connect with nature.
Yeah, exactly. It's a slang. It's going really viral right now. By the way, my son doesn't play for 12 hours straight. It was just a sentence that I took from the internet.
Good.
But it's a slang that's going really viral, and it's really about, or it's used in social media and gaming communities. And it really is meant to encourage people to take a break from the digital world, step outside, and reconnect with reality, as you say. It's used and humorously, or sarcastically, even if you will, mainly for people who are overly invested in internet debates, in gaming, in online drama, and what have you all. And I think it's a new expression, but you hear it a lot in memes right now, and I really love it a lot. And it's basically nothing new, because I've looked it up a little bit. Going back to nature, there's a couple of these, how would I call it? It's not trends, but local terms that are often used. For example, in Japan, you have forest bathing, which is called Shirin-juku. In Germany, you have forest solitude, which means you retreat yourself into the forest, which is called Waldeinsamkeit. I don't know if that is well pronounced. Nia.
That's good. That's good. Yeah.
In Finland, you have something which is called Jokamiehenoikeus, one word. And it's actually a legal concept that says that everybody should have free access to nature. And then in Norway, there is something which is called friluftsliv, which is open air living. And it's also where you see kindergartens and outside, or people try to spend a lot more time outside. So these were the healthenthusiasms of this week. It's time to wrap up the podcast. Thank you for all your healthenthusiasms. It is a healthenthusiasm world indeed. And to the listener, thank you for listening. If you like this show, don't forget to hit the subscribe button on your favorite podcast platform. You can also visit healthenthusiasm.com to discover the other episodes, subscribe to the newsletter, and learn more about our panelists. But don't forget to touch grass of now. For now, I'd like to thank our panelists for their healthenthusiasm. Thank you, Dr. Keith Grimes, Mo Zouina, and Nia Escobar-Kölle. My name is Christophe Jauquet. We are the Healthenthusiasm panel, and we'd love to see you again next week for some more healthenthusiasm. Ciao.